purpose of this video is to review posterior hip precautions and the implication of those precautions on patient positioning and patient mobility. When a patient has a posterior hip replacement, the surgeon has to cut through the muscles in their glutes, and those muscles are what help support the hip joint. So after those muscles are compromised, the patient is at a higher risk of dislocating their hip. The three standard posterior hip precautions are no bending the hip more than 90 degrees, no crossing the legs, and no rotating the leg inward. When your patient is resting in the bed, they cannot cross their legs and they cannot rotate their operative leg inward. Some patients may be given a wedge-shaped pillow from their surgeon. If not, we can use a pillow or a blanket roll in between their legs to help maintain those precautions when they're resting. In this scenario, the left leg is the operative leg, and you want to imagine a line going from the patient's nose, down their belly button, all the way down towards their legs. And that operative leg is not allowed to cross that midline or that center line. If you were to come and see your patient and their toes are rotated inward, that's a red flag, and you should get the nurse and not get the patient up. Before we get up, I'll move our wedge, and then my instructions to the patient need to be to move that operative leg just a little bit at a time as we start to sit on the side of the bed so that they don't cross that midline that we talked about. So go ahead and start coming over to the side of the bed. You help at any point that the patient needs help. This looks really good. You can tell that she's moving her hips and her leg together. And then when she's ready, she'll scoot forward and get your feet flat on the floor so you can get your balance. In the sitting position, what is really important so that we don't bend her hip more than 90 degrees is to look at how the knee and the hip are aligned. You want the knee to be lower than her hip. This is a good position. If she were any taller or if the surface were any lower, that would put her in a position where her knee would be up higher than her hip, and that would be breaking the hip precaution. 90 degrees is when the hip and the knee are in line, and they cannot bend forward anymore, or they can't lift their knee any higher to make that 90 degrees smaller. When we're ready to have our patient stand, this is another time that our hip flexion, no bending the hip past 90 degrees is broken, because people like to use their shoulders for momentum to stand. But when they lean their shoulders forward, we're closing that angle at the hip, and they oftentimes can break their precaution doing that. So what I'm going to have my patient do is I'm going to have her put her hands on the bed to push up. I'm going to have her extend her operative leg out in front because that gives us a little bit more space at the hip. And then I'm going to help remind her to keep her shoulders upright. And that means I might have to give her a little bit more of a boost because she can't use any trunk momentum like she might be used to doing. And then when you're ready, you can push up and grab the walker and put your feet comfortable underneath you. When your patient is walking with a walker after a hip replacement, there's a certain sequence that's going to help with their pain control and their stability. First, they're going to roll the walker forward, then step forward with their surgical leg into the walker, then their strong leg. And this sequence is repeated. And then as you turn to back up towards the wheelchair, keep the walker nice and close to you. And then your patient should feel the chair behind their legs so that they know they're close enough to sit. And before they start to sit, they should step their surgical leg out in front of them. A half a step to a whole step. And then from here, you can use your arms on the armrest to help lower yourself. Having that surgical leg out in front can help make sure we're not bending our hips past 90 degrees, and it can take some of the pressure off and have better pain control. For toileting after a posterior hip precaution, the number one precaution that is most often broken is bending the hips past 90 degrees. Especially here, our toilets are really low, so the patient has to have a commode, and then often at home they need a commode or a toilet riser. The other precaution that we need to be careful of during toileting is not to internally rotate the leg. And this happens when either the leg rotates in or the leg stays where it's at, but the trunk rotates. So if your patient is twisting to perform a hygiene task, they could be internally rotating their hip, and that would break their precaution. So it's important that they're keeping their trunk straight and facing forward when they're trying to perform their hygiene, and they may need assistance with this until they go through more OT training and can do it independently without breaking their precautions. When it comes to hygiene after a posterior hip replacement, we need to be careful about the patient twisting when they're trying to reach their bottom to do their hygiene task. So how I'm going to cue my patient is that she is able to lean forward a little bit because we have her on the commode. She will not bend forward more than 90 degrees. So she can go ahead and stand up a little bit and use her right hand to reach around and perform her hygiene task. And in this scenario, her left hip had surgery. If able, the patient will keep their trunk as straight forward as they can. If they have to twist, it should be away from the surgical leg. This is a task that the patient might need help with in the beginning until they get the hang of their precautions and their abilities. Now we will review positioning in the wheelchair. So as a reminder, our patient's left leg is the leg that had surgery. So her right leg, she can march up, she can lift it up however she wants to get this leg rest in. For the operative leg, we cannot have her march that knee up or she'll be breaking her hip precaution of bending the hip more than 90 degrees. So we need her to kick her leg out straight, or we'll support it if she needs help. And then from here, she'll just bend at the knee to lower her foot onto the footrest. With the tray tables, when they are expanded and the patient's belongings are on the top tier, they really have to bend forward in order to reach their items. So go ahead and try to answer the phone. I would stop her if she's bending her hip more than 90 degrees. So what's recommended is to keep it as a single tier, and we can introduce the bedside table if they need more room. Everything needs to be within an arm's reach without the patient having to bend at the hips. If you are setting up a tray table or a bedside table next to your patient as opposed to in front of them, it does matter which side you put it on. If our patient is going to reach towards the side of her surgery to reach for the tray, she will be breaking her hip precaution because she'll actually be internally rotated at the hip. So go ahead and pretend to reach. Right here, her hip is internally rotated, even though her leg didn't move, it was her torso that moved. So instead, we would have the patient reach towards the side that didn't have surgery. Then her hip stays in a safer position. So to review our posterior hip precautions, there are 3 standard precautions. 1, no bending your hips past 90 degrees. 2, no rotating the surgical leg inward. And 3, no crossing your legs. If you have any questions after watching this video or in real time, reach out to your nursing supervisor or your rehab supervisor. And thank you for watching this video.